to the Inspired Hygiene podcast. I'm your host, Rachel Wall. I'm an RDH and founder of Inspired Hygiene. For over 20 years, we've had the unique opportunity to see what really happens inside thousands of dental hygiene ops and what it takes to create transformational change that impacts the lives of patients, practice owners, and teams. Each season, we'll focus on one powerful topic, breaking it down with practical strategies, real stories, and tools you can use right away. Let's get into it. Welcome back to the Inspired Hygiene podcast. Thank you so much for listening. Thank you for being with us, everyone. I'm so excited to welcome Katherine Gilliam today. Hi, Katherine. Thanks for being with us.
Hi, Rachel. I'm so excited to be with you.
I am too. Katherine is lead clinical coach with Inspired Hygiene, and we have a very long history together. So, Katherine, you and I met in 2000, maybe 1999. Do you remember?
I think it was 1999.
I think so too. And so tell us a little bit about you, and then we'll talk a little bit about our history together.
Sure. Okay. So I've been a coach since 1999. I've been a dental hygienist for 40 years, which is just mind-boggling to me. I love being dental hygienist, and it's, to me, such a fabulous career because we have so many things we can do as dental hygienists, and we have such relationships with our patients. But I never, ever imagined that I would be doing it my whole entire life. Somehow it didn't dawn on me in my 20s that I would still be here in my So I am still here doing that and still loving it. So it's been a long career. I love practicing. I love coaching because we can really create that ripple, taking care of more patients this way than we can with our own two hands. So it's super satisfying in that way. It's great to help other hygienists learn to love the profession if they've been a little burned out. We can get them back and loving what they do again. So, yeah, I'm happy to be a coach. I'm happy to be a coach with Inspired Hygiene, especially.
Thank you for sharing all that. That ripple effect really is, I would say, why I do what I do. I believe the same is true for you. And over the last 25, 26 years, working between speaking and coaching, all those things, thousands of hygienists and tens of thousands of patients, it really is an honor to be able to do this work just to help teams step into more of what really their ultimate potential to provide incredible care and to have a satisfying career. So we're going to talk a little bit about that today too. But back to 1999, we met. We were both hired by another hygiene coaching company that was led at the time by Victoria Peterson, who is now partner with the Productive Dentist Academy. And she really helped mentor both of us into becoming coaches. And one thing led to another. And then you and I were able to come back and work together over the last 7-8 years. And it's been fantastic. And so I love having that history with you because I remember some of those early days. It was really awesome and fun. And we've learned so much. So the title of today's episode is Unlocking Hygiene's Full Potential. Better care, energized teams, stronger practices. And this is way bigger topic than this short podcast can do it justice. So this is going to be an ongoing conversation. And honestly, this title, Unlocking Hygiene's Full Potential, is really what Inspired Hygiene is all about. And I know that's really what your work is all about too, Katherine.
Right. Just helping hygienists elevate the standard of care is opening such a big door because there's so many things we can do to help heal our patients. And that in turn gives us more job satisfaction, helps our practices grow and be healthier. So there's a lot of potential here, maybe more, just like I didn't realize how long I would love being a hygienist and never want to stop. It's the same. Maybe so many of our listeners have no idea how big this picture can be. Tons of potential.
I agree with you. Yeah. So really this could be the title of the whole podcast and everything. So all right, let's dig into this because right now what we're seeing, like we see this potential for hygienists and hygiene teams in practices and how the impact has that the triple win we call it, like everyone's hearing about this on every episode. Uh and right now the dental hygiene profession is seeing some potential significant changes to licensing and educational requirements coming across in many states. And we've seen this happening as of recording. Um, it was proposed in Nevada. That didn't pass. That doesn't mean that it won't come up again. I just saw something recently about Georgia potentially putting in place a program similar to what Alabama has had in place for decades. And it's making hygienists very nervous about the sustainability of this profession. And I know that we believe in maintaining, really elevating the level of education that hygienists have before they serve patients and then continued education as well, because we can see the big picture of what the dental hygiene profession and the dental hygienist can do that impact on overall health. As I've said before, perception is reality. So I'd love your input on this is what we see, and you brought this up in the pre-show, Katherine, is we have done thousands of chart audits with Inspired Hygiene. And what we see very common is that either there's a lack of thoroughness in the periodontal assessments that are being done and charted and recorded, or it's just lacking altogether. And that even then when that documentation is there, so a perio chart, for example, it is almost never complete with all the complete data that needs to be recorded, or the treatment that is then recommended doesn't match what is being revealed in that diagnostic assessment. And so what that shows us and what we have seen over and over time and time again, and I will say this too, the practices that we work with are in the top 10 to 20% of proactive practices. And that's not a brag, it is just a fact, is that probably 20% of dental practices, and that might be generous, actually hire a coach to come in and provide additional support, to be an outside eye to help them improve. So this is a top tier of practices, and even those still are not fully implementing these core diagnostic processes. So when outside entities, whether that is dental practice owners, whether that is public health individuals, legislators, if what they see from the dental hygiene profession is scale polish and bitewings, prophy bitewings, then what they might see is, okay, could this be delegated to an individual that is it necessary? If that's what's happening over and over in a hygiene visit, is it necessary for that hygienist to have that level of education that's now required? So what's your take on that?
Well, the hard truth is that hygienists are very upset about this pending legislation and all of the chatter in various states and all over social media about bringing in an oral preventive assistant. But the hard truth is that we've brought that on ourselves. And as we've done these thousands of chart audits, when we begin working with our clients, we've seen that maybe 15% of patients are receiving a comprehensive periodontal assessment with any regularity. And that should happen a minimum of once a year. And I truly believe in a periodic periodontal assessment, which is done every time you see the patient. Yes. So when we're not doing that, which we all learned in school, which we know is our responsibility to provide for our patients at least once a year, then we have brought some of this on ourselves. And of course, it's a multifactorial issue, right?
Yeah, it is.
Seems to have really come to a head after COVID when so many dental hygienists left the profession. And we have not had enough years go by with students in dental hygiene school to make up for that loss of professionals. So there is a lack. Many of our dentists, many of our teams are struggling because they don't have enough hygienists to provide care for all of the patients. So there's that lack of hygienists, and the fact that hygienists who are out there practicing are under a lot of time pressure to be able to see a lot of patients because there are so few hygienists working. And so one of the things that's been dropped or is not being done is that thorough assessment. If we're not assessing our patients, then we're not diagnosing periodontal disease, certainly not in the earliest stages where we could really have an impact on the patient's overall health as well and prevent serious systemic diseases. So disease is being found at later stages and being treated then, if at all. So there's a real snowball of problems happening here, and we are not the victims. We are partially to blame. So where I feel like we have been victimized is in those states where they're talking about this legislation to allow dental assistants to perform prophylaxis and not consulting the Dental Hygiene Association in that state. That's where I think we've been treated very, very unfairly. In some states, I think the Dental Association has been trying to work with the Dental Hygiene Association, but that has not happened across the board. And that, for me, really should be a big part of the solution, is the two entities working together before trying to press legislation into practice. But yeah, we do have to look at ourselves. And if we want to hope for our future to protect our patients and to protect our practice, our profession, then we need to accept the responsibility of elevating the services that we provide, performing at the top level of our licensure, and doing better care for people and for our practices, so that we can stay in this profession that we care so much about.
Yep, and be relevant, because that's what we're really risking, is licensed, registered dental hygienists that have been through traditional educational programs risk not being relevant. And so in order to be relevant and to really show that full expression of our education, because we see on social media lists of all the hours that we've spent doing all of these different things, and that's 100% accurate. And also what we're seeing show up in chart audits is 100% accurate. We're not just sharing a feeling, we're sharing documented evidence of a lack of full expression of that education and what we're capable of in licensing. And again, there are lots of different layers to that with regards to obstacles that occur in practices for implementing some of these things. And that needs to be brought up as well. And that's one of the things that we do with our clients at Inspired Hygiene a lot is talk about those hard truths with the whole team, because there are hard truths that leadership must face as well as the team members. And when we can really help facilitate the leadership and the team coming together, it is amazing what can be achieved. And we see hygienists continually step up their game and the services that they're providing. So that's really what we're going to talk about today. So we've laid the groundwork of why this is necessary. And you have a way of describing this. And I've always said, hygienists, we have to step up and we have to really step into our role as healthcare provider so that we are utilizing that physiology, the pharmacology, all of those things that we learned in dental hygiene school for the betterment of ourselves and our patients and our practices. But you have a different term for this, Katherine. You you really believe in the term healthcare practitioner. So tell us, why do you choose that term? Why is that so important to you, and that we use that term?
Well, it started for me when I realized that healthcare provider or dental provider is terminology from insurance companies.
Okay.
And that just stuck right here. I didn't like
Mm.
that because I prefer to disassociate from dental insurance companies who are trying to control the care that we can give our patients. And so many practices fall into that trap or that habit of recommending treatment because they know the patient's insurance will um, pay for a portion of that treatment and they'll have less pushback from patients about out of pocket costs and all of that whole picture. So for me, healthcare practitioner differentiates us because practitioner is a real healthcare term as opposed to provider, which really came into popularity once dental insurance became part of the picture. So that's the personal issue I have with that terminology.
Well, thank you for sharing that. And this is something else that we see that's really interesting, even in fee for service practices. I can think of one example in particular, a very high end, high level fee for service practice that we worked with still had some, I will say, leftover legacy mindset around insurance. And we are realists. We believe that we all need to work together. We believe that it is important for practices to help their patients maximize whatever benefits they do have. However, as healthcare practitioners, our job is to present the treatment that is in the patient's best interest first and foremost, and then figure out where the insurance may contribute to that care. And then it's the patient's decision how they move forward. But it's really not fair for the hygienist, the dentist, the dental assistants to make that decision for the patient before the patient even has that education on their condition and what the solutions are for whatever dental problems they have. So that's another podcast too, and I love that because as we're starting this podcast, we're uncovering lots of other layers, right, to these challenges that we can really dig into. And one is that insurance dictating care. In so many practices, remember, these are top tier practices, say, no, we don't allow insurance to dictate our care. But then in the very next breath, they'll say, well, their insurance isn't going to pay for that. And it's like, we just said that we weren't going to let insurance dictate treatment. But so we do have to look at that. We do have to look at that, and we can dive into that in another episode. I think would be a very good thing to do. But let's talk about what expanding hygiene services really looks like. And this is going to be the topic of the next several episodes. I'm going to talk a little bit about season 2 before we wrap up today. But I think we've already touched on that, really, is that full expression of our education and the full impact of what we are able to do as true healthcare practitioners is almost infinite when we partner with our dentists, because there are in certain states, right, limits to our license and things that we can do. But as we learn more about different services, different products, and things that are available to us as dental care, practitioners, it is going to continue to grow in what we can do and how we can continue to expand hygiene services. Now, on the last episode, we talked about hygiene compensation. We talked about the profitability benchmark. And one of the questions that we're hearing and we're seeing a lot is it still possible to have a profitable hygiene department? And the answer is yes. And one of the keys is to really expand the services. And it really benefits our patients, it benefits the practitioners, and it benefits the practice as a whole. So let's do this, Katherine, by looking at this in different tiers, expanding hygiene services into different tiers. And we're doing this in order to help people kind of wrap their brains around where to go next. Like, where are you now? This will help you determine where you are now as a practice and as a hygiene team, where you could go, but we don't want to put a cap on these tiers. We're just going to give you a few of these, but you may have a whole nother level that you want to achieve in your practice, and by all means, go for that. So let's start, Katherine. What does it look like at, let's say, tier 1 of expanding hygiene services? So if we're starting out where the vast majority of the build services from hygiene are prophy and bitewings, what is tier 1? What things might the hygienist add to their services in that level?
Well, I think the very, very first thing that teams need to do, especially the dental hygienists, is expand their identity and make sure that they're focusing not just on the oral health, but on the entire health of their patient. So, so we're going to talk holistic and not just being biological, but really whole patient care. And that definition of being holistic. So if we're talking about whole patient care, then tier 1 needs to start with vital signs. Let's check the blood pressure and pulse, and maybe even pulse oxygenation while we're at it. We started that during COVID, and it's a really good habit to be in. We can monitor those levels for our patients and make sure that their baselines are within health. And we're not only going to partner with our dentist here and make sure that we're aligned in that way, but also with other healthcare practitioners, because we do have limits to our licensure. So if we see there are some issues with our patients being hypertensive, for example, then we need to have a doctor to refer them to a physician who can help them. So we really have to expand our mindset there about taking care of the whole patient, and realize that we hear this all the time, but really integrate the fact that we're the first line of defense for our patients. They truly see us more often than they see any other healthcare practitioner. And we have the good fortune to have more time with these patients so we can ask more questions. And that's the next thing. After we take those vital signs, we need to dive deeply into their health history and talk about all of their health conditions and their genetic conditions with family history.
Mm-hmm.
Connect those with their oral health, and connect it in such a way that it's not just in our minds, but in our patients' minds. So they understand how their oral health can impact their overall health and vice versa. So those are two very important steps in tier 1, the vital signs, diving deeply into the health history. And then we're going to do some life-saving health screenings. We're going to do head and neck cancer screenings every time we see the patient. We're going to screen for airway challenges. When we're doing the head and neck exam, we can look at their airway. It's the perfect time and it's very efficient. And if they have airway challenges, we need to be able to refer them. Maybe they need a myofunctional therapist. Maybe they need an airway specialist, and we need to look at a CPAP after a sleep study, or an Inspire implant, or something that we can't help the patient with. So we have to have someone to refer them to. And then again, we will do a comprehensive periodontal assessment in tier 1 and do a comprehensive diagnosis and treatment plan for the patient, and make sure, as you mentioned, that what we see on that periodontal chart has an appropriate treatment plan. So often we have teams who start doing an examination, a periodontal assessment, and then they don't know where to go after that, or they have obstacles in their way about treatment planning and with mindset. Will patients accept this? Will patients be upset because we've been seeing them a long time? Why now are you telling me I have disease? So, of course, in our coaching, we address all of those obstacles and work on some communication skills to address those questions. But the bottom line is we have to do the proper assessment and the proper treatment plan for that patient to treat the disease that we're finding. So all of that falls under the umbrella of tier 1.
Okay, so there are a lot of teams that have a lot of opportunity to grow, even just in tier 1.
Absolutely.
So if you were listening and you feel like we've got all that covered, awesome. I would say go and verify that, right? In the next season and in the next couple episodes, we're going to dig into having a clear written standard of care, because that is going to help guide some of these diagnostic screenings that we talk about, these life-saving screenings, and how you really get that in writing so that everybody agrees to move forward with that. But that there's a lot in tier one, and I agree with you. Those are the basics. So if those things aren't happening, then we've got to go back to the basics and really focus on those core things. Okay, so what about tier two? What were some things that could then be brought in as far as care services, products in tier two?
Yeah, tier two in my mind is all about adding adjuncts. So, what we know through the research is that um, non surgical periodontal therapy can be very, very effective in improving not only oral health, but systemic health as well. And we know through the research that periodontal disease is a multifactorial disease, and there are certain pathogens that are particularly resistant to scaling and root planing. So we can do our absolute most perfect work with our highest skills, and still the patient will not respond. And that has been so frustrating over the years until I learned that, oh, well, it's because now I'm doing this microbial testing and I see, oh, we have pathogens here that are not responsive to this treatment. So we need other arrows in our quiver, right? We need some other adjuncts to help support the non-surgical periodontal therapy. And we have some great adjuncts now available. We have desiccants to actually help us remove the liquid or the water from biofilm and from calcaneous deposits. And that helps us remove those deposits more easily. We have medical grade ozone, which can actually kill the pathogens while sparing healthy cells. Um, Laser therapy to target deep into the tissues, because we know those microbes don't just sit waiting for us patiently in the sulcus, right? They're entering into the epithelial tissue, and our scalers can't reach there. So to have other adjuncts that can go into the tissues like laser and kill those pathogens is unbelievably exciting to me. That we can really address that infection that way. We have Perio Protect trays with 1.7% hydrogen peroxide, so we can add oxygen subgingivally to kill those anaerobic bacteria. It's so effective, and spares us from having to use antibiotics, because we have to be good stewards of antibiotic use now. We've got probiotics to rebalance that oral microbiome. That's an excellent adjunct to use. And then we have adjuncts to even help with caries disease. So it's not all focused on periodontal disease. So we can expand our service mix to prevent dental caries beyond fluoride. So for those people who prefer not to use fluoride, we have hydroxyapatite, calcium carbonate, arginine bicarbonate, lots and lots of xylitol, and lots of products we can use to help prevent caries. And now we can even treat incipient caries and white spot lesions with Curodont. For me, it's to have this big list of things that I can pick and choose from to help my patients heal is super exciting. And that's another thing I wanted to mention. We were taught that we can't heal periodontal disease. We can't cure it. We can improve it and we can maintain it, but we can't heal these people. And I think that is absolutely the wrong mindset. Now we have seen regeneration of bone, and we have seen true healing and health happen with use of adjuncts. And if we could just work on our mindset that we can be true healers, it will make a big difference, because I think that mindset of, well, it's the best I can do, and I'm doing that, puts us in a place of stagnation and frustration. So if we can think about being real, true healers and curing this disease, it's motivating and exciting, and it gets us open to all of these different adjuncts.
Yeah, I agree with you, Katherine. I love that's just what you've shared is so exciting and inspiring. And frustration was the term that came up for me too, when we think about, well, all I have is to go in and scrape these roots again over and over, and that's not working. And so many times hygienists feel defeated, they feel limited on what they can provide. And now, with what we have available, if we can open our minds to this and be open to trying different things and having different conversations with our patients, and every bit of this requires us to step out of our comfort zone.
That's right.
And it might be a bigger step for some than for others, but even adding one additional service, you've got to learn, how does this fit in with the workflow? What is the diagnosis that might lead to me recommending this treatment? Is my team supportive of this treatment, and do they all believe in it? Doctors, how are you helping the hygienists get motivated to embrace these things? There's so much out there that I'm with you. I believe that we can make an incredible difference and not feel like we're continually chasing disease, because our patients deserve better than that. And so do you as practitioners, whether you're a dentist, a dental assistant, or a hygienist. You deserve better for that than that. And those solutions are out there. Okay, so we've just talked about tier 1 and tier 2. So tier 3 then comes into a lot of these advanced screenings. So we talked about the basic screenings: airway, oral cancer screening, medical history screening, blood pressure, periodontal screening. Those are the basics. So now, what are some of these things in tier 3 that could give us maybe more information and really help us guide our patients' overall wellness?
For me, the absolute number one screening is, besides the cancer screening and the airway screening, is microbial testing. So that opened up a huge world for me when we started doing it years and years ago in our practice, because we could see what we were dealing with. We could see the pathogens that were affecting our patients, and we could see the results of our treatment. So when we do follow-up screening, we can see, oh, I've eliminated these pathogens, but now these others, because I've disrupted that balance, now we have to deal with these others. And then we get to the point where we do another follow-up and we can see that everything is quiet and we have our patient in remission. So that really gives us an endpoint to treatment. Whereas before testing, we didn't really know. We didn't really know if we had succeeded. And what we had was a lot of refractory disease. And now we know maybe it's not refractory. Maybe we're just not there yet. There's still more work to do. So microbial testing, number one. And for me, it goes hand in hand with using a microscope, because that education for the patient, where they can see a busy slide and they can pick out the spirochetes and know that those are such dangerous pathogens, and they can go spiraling right up and across the blood-brain barrier or across the placenta. And then they can see their lab test results from that microbial test. And patients understand lab tests and they understand infections. So it really connects our patients with us and helps us partner with them so much more closely in helping them achieve their health goals. So that is super powerful. In tier 3 also, we can add chairside HbA1c testing for anyone who has a glucose control problem. If they've been diabetic, diagnosed with diabetes or diagnosed with pre-diabetes, then we can help screen them. And there are actually practitioners who will not move forward with periodontal treatment until they see an A1C that proves the patient's glycemic levels are under control, because we know that bidirectional relationship is so foundational that we won't see good results until we have better glycemic control. And sometimes we won't have better glycemic control until we do the periodontal therapy. So it's really very closely related.
Mm-hmm. Yes, and I would say, so I want to make sure before we wrap this up that we address where some folks might be feeling overwhelmed, right? They're excited, and maybe you're feeling excited, but where do we start on this journey? And again, I would say go back to tier 1 and make sure you have those basics in place first. but this doesn't all have to be implemented at once. In fact, we do not recommend that, right? We recommend going back to those core diagnostic foundations and then adding from there based on where the team feels like they need those adjuncts the most and their patient base would benefit the most. And then starting with one, getting the education that you need, getting it implemented, getting all your workflows down, and then, seeing yourself implementing that for a while and then adding the next thing, because it can be overwhelming and you can look at these patients and feel like I can do so much for them. I don't want to pile all of this on top of them at once. So it does take some time, and that's where coaching can help too. I know that's certainly one way that Inspired Hygiene helps clients, and I know there are other coaches out there that help with that too, but is helping with the sequencing of some of these things and really helping clear out some of those obstacles that are happening within the team and the practice so that these things can be put in place and can be successfully implemented with the patients as well. Because a lot of team members also worry, how do we bridge this communication gap, right, with the patients when if we've just been doing prophy and bitewings for years, now we want to implement some new things. How do we have these conversations? I know we work with practices around that all the time. And then I would say, Katherine, for tier 4 and beyond, there's just so many things like myofunctional therapy. We have hygienists in the country that are practicing independently. We have some that are going independently into nursing homes where there's a huge need for a higher level oral care for these individuals. And the list just goes on and on. And you teach biologic hygiene, which we're going to have you back to talk about those concepts as well. And I think there will be growing interest in that. I know I've been hearing growing interest in that from my friends and family members, and there's growing awareness around that too. But any last thoughts that you want to share just about expanding hygiene services and maybe a first place to start, or just any advice that you would have?
I do think that the most important thing is for the doctor and hygienist to get together and talk about philosophy of care and make sure that they're very aligned in the type of path they want to take to help their patients achieve optimal oral health and systemic health. And that will help determine what the next steps are. And of course, I truly believe that practices need a coach because it can be overwhelming. And what happens when you dive into too many new things at once, at first you're very, very excited about it. And I'm going to do this and I'm going to do that. And then you get overwhelmed because you still only have the same amount of time in a day. And that's when we see, the guided biofilm equipment gathering dust in the corner because, and the
Laser.
the laser and all those great technologies that we have, instead of being implemented for every patient, it's become overwhelming. And so they don't get used at all. So when you first align your philosophy of care and then develop strategies for next steps, it can be done very systematically and in a way that doesn't overwhelm, and you can practice the communication skills, and patients can get used to the fact that you're doing new things and learning new things and bringing new technologies for their benefit. So that's what I would recommend as far as getting started. And then the sky's the limit. Like you said, tier 4 and 5 and 6 is as far down that path as you want to go. And the really exciting thing is that we have lots of research to support this type of care. This is not going out so far on a limb that it's beyond what dentistry and what science can support. This is very much in our wheelhouse and proven to help patients achieve health. So for us, it's super exciting to help you and help your practice grow in this way. And I'm excited to be talking about it today. I think we could talk more about this because truly the sky's the limit, and you can be the hygienist and the healer that maybe you've always wanted to be.
Yep. Yep. And I would say to loop back to how we started this episode is really, it is a time, there is a sense of urgency for high level dental practices and dental hygienists to really communicate how your differentiation, to really differentiate yourself and to stand out and to really demonstrate why your education is so valuable and how you're utilizing that education on a day-to-day basis to really provide high-level service to your patients that is outside of only the prophy and bitewings. So really, this is a great conversation starter for teams to really say, like, where do we see our hygiene department going? Where do we see our practice going? And where do we really want to put a flag in the ground in our community to stand for this really high level of care and start educating your community around that. So want everybody to stay tuned. This wraps up season 1 of these hot topics. And season 2, we're going to start diving into part of this tier 1. And really it is taking a close look at that core responsibility of dental practices and the hygiene departments around periodontal diagnostics and helping you really discover where are you on that spectrum of consistency with diagnosis, continuity of care, and where can you really put some energy in that area to make sure that that is really strong in your practice. So we're going to be diving into that in season 2. So stay tuned, because based on our experience, 90% of the practices out there have an opportunity to grow in this area and really refine things. And you're going to get some really good action steps and tips that you can implement from these upcoming episodes. So Katherine, thank you so much for being with us today. This was fantastic and very inspiring, even for me. I just always love hearing you speak, and you just have such a way of bringing this to life and making these high levels of care really approachable. So thank you so much, and thank you everybody for listening.
Thanks everybody. Thanks, Rachel.
Thank you so much for listening to this episode of the Inspired Hygiene Podcast. We hope you got a ton of value and some things that you can really take away and implement now. So as always, we invite you, if we can help you in any way to optimize your hygiene department, head on over to inspiredhygiene.com. And as always, stay inspired.